This contraceptive is a small, flexible ring that is inserted into the vagina and slowly releases the hormones etonogestrel and ethinyl estradiol to prevent pregnancy. It does not protect against sexually transmitted diseases. It is important to use this contraceptive as directed by your healthcare provider. It is typically inserted and left in place for 3 weeks, then removed for 1 week before inserting a new ring. It is best to insert the ring on the same day of the week each time. If the ring is accidentally removed for more than 3 hours, it may not be as effective in preventing pregnancy. If you have any concerns or questions about using this contraceptive, be sure to consult with your healthcare provider. Before using this product, make sure to carefully read the patient information leaflet provided by your pharmacist. It contains important instructions on how to use and dispose of the vaginal ring. If you have any questions, don't hesitate to ask your doctor or pharmacist. To use the ring, wash and dry your hands, then remove it from the foil pouch. Fold the ring in half and gently push it into your vagina until it feels comfortable. Keep the ring in place for 3 weeks in a row, then remove it on the same day of the week and about the same time that you placed it. During the first 7 days of using the ring, use an additional form of non-hormonal birth control, such as condoms or spermicide, to prevent pregnancy. After 1 ring-free week, insert a new ring on the same day of the week that you removed the old ring, whether or not you have your period. If you do not get your period, consult your doctor. Regularly check that the ring is in place, and if it accidentally falls out, rinse it with cool to lukewarm water and reinsert it as soon as possible. If it has been out longer than 3 hours, use an additional form of non-hormonal birth control for the next 7 days to prevent pregnancy. If you have left the ring in place longer than directed, you will still be protected from pregnancy, but if it has been longer than 4 weeks, you may not be protected. Contact your doctor for further instructions. Common side effects of using Enilloring 0.12 Mg-0.015 Mg/24 vaginal ring contraceptives may include vaginal discomfort/irritation, nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to note that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. Enilloring may also raise your blood pressure, so it's recommended to monitor your blood pressure regularly and inform your doctor if the results are high. In rare cases, the ring may accidentally be placed into the bladder, resulting in urgent/frequent/burning/painful urination. If you experience these symptoms and cannot find the ring in your vagina, it's important to contact your doctor promptly. Additionally, Enilloring may rarely cause serious, sometimes fatal, problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek immediate medical attention if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, or sudden shortness of breath/rapid breathing. It's also important to be aware of the possibility of a very serious, possibly fatal, bacterial infection known as toxic shock syndrome, TSS, in women using vaginal rings. Remove the product and seek medical help right away if you develop symptoms of toxic shock syndrome, including sudden high fever, severe/sudden dizziness, fainting, unusual muscle pain, or sunburn-like rash. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. It's important to note that Enilloring 0.12 Mg-0.015 Mg/24 vaginal ring contraceptives should not be used by individuals who smoke cigarettes or use tobacco and are over the age of 35. This is because smoking can increase the risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. It's important to refrain from smoking or using tobacco while using this contraceptive. Before using this product, it's important to discuss any allergies you may have with your doctor or pharmacist. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to talk to your pharmacist for more details. Before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have a history of blood clots, high blood pressure, cancer, depression, diabetes, heart problems, liver disease, obesity, or other conditions. If you have diabetes, this medication could affect your blood sugar levels, so it's important to monitor your blood sugar regularly and consult your doctor if you experience any symptoms of high blood sugar. It's also important to let your doctor know if you have any upcoming surgeries or if you will be confined to a bed or chair for a long time, as these conditions could increase your risk of blood clots. Additionally, it's important to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. The hormones in this product may cause dark areas on your face and skin, and sunlight may worsen this effect. It's recommended to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. If you are nearsighted or wear contact lenses, you may develop vision problems or have trouble wearing your contact lenses, so it's important to contact your eye doctor if these problems occur. This medication must not be used during pregnancy, and it's important to consult your doctor if you become pregnant or think you may be pregnant. It's also important to discuss reliable forms of birth control with your doctor if you have just given birth or had a pregnancy loss/abortion after the first 3 months. Finally, the hormones in this product may decrease breast milk production and could pass into breast milk, potentially affecting a nursing infant. It's crucial to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions that may affect how well this contraceptive works. Some products that may interact with this drug include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively, such as griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new medication, be sure to discuss with your doctor whether you should use a reliable non-hormonal backup birth control. Also, it's important to inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that the birth control is not working effectively. Lastly, be aware that this medication may interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this contraceptive. If swallowed, this product can be harmful, although the likelihood of an overdose is very low. It's important not to use more than one ring at a time. If someone has overdosed, remove the ring if possible. If serious symptoms such as passing out or trouble breathing occur, call 911. Otherwise, contact a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222, and Canadian residents can call a provincial poison control center. Remember to always follow the dosage instructions provided by your healthcare provider for optimal effectiveness. It's important not to share this medication with others. While using this contraceptive, it's important to have regular complete physical exams that include lab and/or medical tests, such as blood pressure, breast exam, pelvic exam, and pap smear. Make sure to follow your doctor's instructions for examining your breasts and report any lumps right away. Don't forget to keep all medical and lab appointments. If you need more details, consult your doctor. If you're using the Enilloring 0.12 Mg-0.015 Mg/24 vaginal ring contraceptives, it's important to follow the instructions provided in the product package. It's also a good idea to use additional birth control methods like condoms or spermicide to further prevent pregnancy. If you find it difficult to remember to remove and reinsert the ring as directed, or if it keeps falling out, it's best to talk to your doctor about possibly switching to a different form of birth control. It's important to take this medication at the same time every day for it to be most effective. It's important to follow the specific storage instructions for the brand of Enilloring 0.12 Mg-0.015 Mg/24 vaginal ring contraceptives that you have. Make sure to check the product package or ask your pharmacist for guidance. It's crucial not to use the product after 4 months or after the expiration date, whichever comes first. Keep all medications out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product. Never flush medications down the toilet or pour them into a drain unless instructed to do so. For more details on how to use this product, refer to the How to Use section. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.